All right, let's get right into it. Today, we're basically becoming medical detectives. Because in the world of healthcare, every single diagnosis is a case that needs to be solved. And the solution? It's always a very, very precise code. Our investigation is going to take us deep into the genitourinary system. So let's dive in.
So just think about something super common, something you've definitely heard of, a urinary tract infection, a UTI. Seems pretty straightforward, right? But for a medical coder, UTI isn't the answer. Oh no, it's just the first clue. The real work, the detective work, is figuring out what that clue actually means in a universal, data-driven language. And boom, right away, you can see how deep this rabbit hole goes. See, UTI isn't a code, it's just a description. A coder has to ask, well, what's the cause? Is it a specific kind of bacteria? Or in this case, is it a fungal infection like candidiasis? That one little distinction, it changes everything. It leads us to this highly specific code, B37.49. And that right there, that's the goal of this entire system, absolute precision.
Okay, so where do we start our investigation? Well, we've got to go right to the heart of the urinary system, the organs that filter our entire blood supply, the kidneys. And let me tell you, understanding how to code for kidney conditions is absolutely fundamental to mastering this whole chapter.
So here it is. This is our crime scene, so to speak. You've got the two kidneys, the ureters that act as little transport tubes, the bladder for storage, and the urethra. The thing is, an issue can pop up in any one of these parts, and you better believe every single one of those issues has its own unique set of codes.
Now, one of the very first, most critical questions a medical detective has to ask is all about timing. Is this problem sudden, or is it a long-term thing? On one hand, you have acute kidney failure. Think of that like an emergency shutdown. It happens fast. But chronic kidney disease, or CKD, that's a whole different animal. It's a slow burn, a gradual decline over many, many years, and it's often tied to other health problems. Getting this distinction right is step one.
And this is where the real detective work kicks in, because it's hardly ever just one single condition. A great coder knows how to connect the dots between different diseases to tell the patient's full story. This is that aha moment.
So check this out. This guideline right here is an absolute game changer. The official coding rulebook, the ICD-10-CM, it literally tells us that if a patient has both high blood pressure and chronic kidney disease, we should assume they're connected. The doctor doesn't even have to write kidney disease due to hypertension. Nope, the link is presumed. It's a built-in clue. And this table just illustrates that rule perfectly. Instead of using one code for hypertension and a separate one for kidney disease, the system is smart. It gives us these powerful combination codes in the I-12 and I-13 categories. That one base code covers the connection, and then all you have to do is add a second code to specify the exact stage of the chronic kidney disease. It's so efficient. So the process is pretty straightforward. The coder sees hypertension. They see chronic kidney disease and what stage it's at. Then they hunt for that single combination code that ties it all together. And just like that, a really complex diagnosis gets boiled down into two precise codes that tell a much richer story than separate codes ever could. And this technique isn't just for hypertension. This whole concept of a presumed relationship exists for patients with diabetes mellitus and kidney complications too. The system is built to recognize these common interconnected health stories and reflect that in the code.
Okay, so now that we've got a handle on the core principles, we can expand our investigation. We're moving beyond just the urinary tract to the broader genitourinary system, and we'll look at conditions that are specific to the male and female reproductive organs.
Now, obviously, the anatomy is pretty distinct when you compare the male and female systems, but you know what's exactly the same? The principles of coding. Specificity is still everything. It doesn't matter if we're talking about the prostate gland or the uterus, you have to be precise.
Let's take BPH, benign prostatic hyperplasia, as an example. The main diagnosis gets a code from the N40 category. But the story doesn't stop there. The coder has to ask, is this condition causing other problems? Things like urinary retention or a bladder obstruction. If the answer is yes, then you have to assign additional codes for those symptoms to paint the complete clinical picture. All right, now let's flip over to the female system and look at endometriosis. This is a condition where tissue that's a lot like the uterine lining starts growing in other places it shouldn't be. The base code starts with N80, but that's just the beginning. To get it right, the coder has to know exactly where this tissue is located. And wow, This image just visualizes the challenge perfectly, doesn't it? Endometriosis isn't just one thing. It can pop up in a lot of different locations, and the coding system is built for exactly this level of detail. I mean, there are specific codes for the location, the side, left or right, and even how deep the tissue is. This is so much more than data entry. This kind of detail is absolutely critical for tracking the disease and understanding treatment outcomes.
So far, we've really been focused on the diagnosis, the problem. But the patient's story always includes the solution, right? So now we're going to shift our investigation to coding the procedures and treatments that actually address these conditions.
You know, a diagnosis of end-stage renal disease, code N18.6, that's a massive event in a patient's life. It means their kidneys have failed. But for the coder, it's a pivot point. The next chapter is the treatment, which is very often lifelong dialysis. And that, of course, has its own whole universe of codes.
And dialysis isn't specific enough, not by a long shot. How is the patient getting it? Is it peritoneal dialysis? Is it hemodialysis? If it is hemodialysis, is it through a catheter, a graft, or a fistula? Every single one of these methods for accessing the bloodstream is a different procedure, and each requires a completely different code.
This whole principle extends to incredibly complex surgeries too, like breast reconstruction. This isn't just one procedure, it's a whole series of them, and the coder has to capture every single step, moving a tissue flap, placing an implant, any revisions that happen later. It's like a giant puzzle, and every piece needs its own code to document the full scope of care that patient received.
So, after following all these clues from the diagnosis all the way to the treatment, what have we learned? What's the ultimate takeaway from our investigation into genitourinary coding?
It really comes down to this. Medical coding isn't just about billing or data entry. It is a highly specialized language. It's the method we use to translate the complex, messy, very human story of a patient's health into a format that is precise, crystal clear, and universally understood.
And that leaves us with a final question. We've seen how these codes capture incredible detail today. But as medicine gets even more personalized, with things like genetic markers and advanced therapies, how will this language have to evolve? How will we code the even more intricate patient stories of tomorrow? It's a case that's far from closed. Thanks for watching.